Good evening and welcome to the COVID-19 pandemic update. I am Kayode Okikulu. But first, the highlights. Muslims celebrate Eid al-Fitr with substantial adherence to the wearing of face masks as President Muhammadu Buhari calls for peace. And NAFDAC investigates herbal COVID-19 remedy at Afe Babalola University in Ekiti State. Well, out of almost 1.4 billion COVID-19 vaccinations administered worldwide, mainland China gives 354.27 million. Well, that's 1 in 4. Well, it's a day of festivities for Muslims across the country as they celebrate Eid al-Fitr, marking the end of the holy month of Ramadan. Well, in the spirit of the times, President Muhammadu Buhari observed the religious rites with his mask on amidst family and close associates who also had their face masks on at the State House in Abuja. Well, it's the second of such celebration in the COVID-19 era. Last year's Eid saw the president observe prayers flanked by only 8 people after the Sultan of Sokoto and President General of Jamaatul Nasir Islam, Saad Abubakar III, announced the suspension of Eid congregational prayers across the country. But this year, congregational prayers were allowed with a caveat that all Phase 4 COVID-19 protocols must be adhered to. The president seized the opportunity to address insecurity, calling for peace.
The law enforcement agencies are working hard to regain confidence against the bandits so that people can go back to the land. This is very important. This is what the law enforcement agents are very busy about now. The rainy season is coming, so we want people to go back to the land so that we can get enough food for the country and even export. And we are hoping Nigerians will understand the problem. Nigerians know at which stage we came, 2015, what stage we are now, both on security, both on economy. And we are going by the Constitution, we are doing our best. But with the resources available and the manpower available to us, we are working very hard. And I think the National Assembly is cooperating very well. Within the resources available to us, they are certainly giving us priority in our requirements, and we are doing our best. The important thing is the elites must make the attempt to understand the military. If we order, say, weapons and armored vehicles, it takes time for the manufacturers. It takes time when it is brought here, eventually shipped here, taken to our training institutions, training the trainers, and then sending them to. This is a very, very long process. And even if you can have contact with the retired military chaps, they will tell you the difference between the time we came and now, how much hardware we have got, how much training we have done. If you don't know, go and ask people from Borno, from Adamawa, the difference in terms of security. And without security, you can't do anything. And in the South, our biggest surprise and disappointment.
And here in Lagos State, Muslims also gathered at the Dodon Barracks prayer ground in Obalende to observe the Eid al-Fitr prayer rites with their face masks on. Take a look.
The year 2020 came with a lot of challenges as a result of the COVID-19 pandemic, making it impossible for Muslim faithfuls to come together after the 30-day prayer and fasting because of the restrictions on social and religious gatherings. This year, the story is different as worshippers visit prayer grounds for special prayers to mark Eid al-Fitr at Dodan Barracks in Obalende.
Allahu Akbar Kabira.
Muslims came with their face masks as they joined others to thank God for a successful fasting period. The Chief Imam of Lagos State led the prayer session as they make their supplication to Allah.
Allahu Akbar. Sami Allahu liman hamidah. Rabbana wa lakal hamd. Allahu Akbar. Allahu Akbar. Assalamu alaikum.
After the prayer, the Muslim cleric and the State Commissioner of Police bear their mind on the security situation in the country, with an appeal to residents to be security conscious and support government in tackling the challenges.
There is no religion that can prosper in anarchy. So we all need to work together. We need to learn from what happened in Iraq, what happened in Syria, what happened in South Sudan. That no nation can work in disintegration. No nation can work in segregation. We all need to work together.
Enough security arsenal, security strategies have been put in place. Every member living in Lagos should be assured that their lives and property, the threats being portrayed from everywhere, we are having enough security apparatus to confront any threat from anywhere that will destabilize the security of Lagos.
Eid al-Fitr is one of the two major festivals celebrated by Muslims. Residents are still being asked to avoid large gatherings to limit the spread of the COVID-19 virus. Titilayo Aberewu, Channels Television News.
And after going days without a single fatality, Nigeria has recorded its first COVID-19 death in over a week. But this streak was broken at a time when it seemed as though we were experiencing a lull in the daily infection figures. Yet again, another reminder that the virus hasn't gone to sleep just yet. We'll continue to keep tabs on those trends for you here at Channels Television. And here's what you need to know about the latest figures.
As Muslim faithful celebrate the end of the holy month, the Nigeria Center for Disease Control, NCDC, is advising all people to take responsibility and ensure that the safety protocols are strictly adhered to. After the recent review on Nigeria's COVID-19 response, Lagos State is also working to prevent a third wave of infections, as the state government has now placed some countries on its COVID-19 watch list as part of its mitigation strategy. At a recent media briefing, the State Commissioner for Health, Professor Akin Abayomi, says these measures will guide the management of inbound passengers of interest from other countries.
People are arriving from abroad, which is the most likely reason why we might get a third wave. So it is important they follow the guidelines very strictly, which is, at the moment, 7-day mandatory isolation with tests that will determine whether you are free to come out of isolation or quarantine.
Since the last time Nigeria recorded a fatality from the pandemic, the country has now recorded another death, increasing the total fatality toll to 2,066. According to the Nigeria Center for Disease Control, 44 new COVID-19 infections have been reported from 4 states in the last 24 hours. Lagos topped the list with 28 new infections. The latest tally raises the total number of confirmed cases to 165,559. 16 persons have been discharged after testing negative to the virus, raising the total number of recoveries to 156,374. Over 1.7 million Nigerians, representing 86.9% of the target population, have been vaccinated so far.
So Nigeria is confronted with at least 2 major battles at this time, one against COVID-19 and the other against terrorism, kidnapping, banditry and the likes. Now, before now, both battles seemed to be fought on parallel fronts, but that may have changed with the latest statement from the Nigerian Medical Association, the NMA. Well, the group says insecurity is now adversely affecting healthcare delivery and, by extension, It may reduce our chances of winning the fight against COVID-19 and other public health emergencies. So just how bad is this, and how do we shield the health system? Let's speak with Professor Innocent Uja, the president of the Nigerian Medical Association. He joins us live from Benue State. It's great to have you on the program. Prof, it's not every day we hear doctors and dentists speak on issues outside their field of expertise, which is medicine. But you've had to speak up saying that the healthcare delivery is also at risk. So can you break this down for those who may be trying to maybe marry the two?
Thank you very much and good evening. The reality is that Nigerian doctors, by the provision of the Constitution, make comments and make observations on issues that affect Nigerians and Nigeria outside of medicine. However, the issue of the insurgency that we have obviously has a very negative effect on the healthcare system. First of all, the fact that people are being maimed and killed. It's a very serious issue to the healthcare delivery system of Nigeria. One, it creates anxiety. Some nurses and doctors are kidnapped or killed, and the process of going to do their lawful duties. As a matter of fact, while we were in Jos during the just concluded AGM, we presented some of the factors that may have contributed to their deaths, including COVID-19. In circumstances of insurgency, banditry, kidnapping, a lot of anxiety is coming. Anybody whose persons are kidnapped experience anxiety. In fact, it may go to psychological effect, it may go into depression, it might go to severe hypertension, and in fact, stroke. You know that if you are not aware, many of our people, Nigerians, have died as a result of their relations being kidnapped or being killed, you know, as a result of insurgency, banditry, and the rest. And these are direct effect on health. As you know, we are working towards Agenda 2030, which is to say that the universal health coverage will mean that every Nigerian who needs to access healthcare should have access to healthcare. And let poverty not be a factor for not accessing healthcare. As you know, poverty is on the increase. Farmers no longer go to their farms, and therefore access to health, to funding and selling of their products, produce would have gone down, and therefore they are unable to financially access facilities. So, in a nutshell, the insurgency has multiple effects. One, people who are kidnapped may be killed. As you know, doctors are not there for anybody to die. We have to protect life.
Right.
Two, that even those who are affected, that means the relations have anxiety, they suffer anxiety. Those who have hypertension may have stroke. Some will die at the terminal stage of the condition. So there are so many facets. And then, of course, the providers, the doctors and nurses and other health workers are also being kidnapped. And obviously there is anxiety, even going for night duties and calls. Even when ambulances are sent, people are afraid of going by ambulances to the hospital because we don't know the next bandit that is waiting to kidnap the doctors or the nurses. So it's a mirage of problems that we are facing in this country. What it means that the health services delivery system in Nigeria is facing a very bad situation, which must be contained very quickly.
Well, I think it's quite important that you have raised those points that directly affect the healthcare system. Would like to thank you so much, Professor Innocent Uja, the president of the Nigerian Medical Association, for sharing your thoughts with us on the program tonight.
Thank you very much, and good evening. Happy Salah to all of us. Thank you.
We'll go on a break now, and when we return, NAFDAC has been assessing some herbal solution to COVID-19. We'll bring you that and more in a moment. Join us again. You're welcome back. The Director General of NAFDAC, Professor Mojisola Adeyeye, is again assuring Nigerians that all COVID-19 vaccines used in the country passed through clinical trials. Well, besides vaccine trials, the agency is also assessing the efficacy of herbal treatments for the virus as it visits Afe Babalola University in Ado-Ekiti to follow up on a new herbal initiative to cure COVID-19. Our correspondent, Babajide Agbayo, has more.
A research team constituted by the Afe Babalola University in Ekiti State has been exploring plans to find a herbal cure for COVID-19. The 16-month research work, which has reached product development stage, has drawn the attention of the National Agency for Food, Drug Administration and Control, NAFDAC, which has visited the school for its findings.
Nigeria, or Africa at large, has resources called plants. And these plants contain chemicals that are capable of curing COVID-19. And what I have explained there is to tell you the published papers, is to explain to you the data that support our claim. Those have been published and others have been shown during the course of the presentation.
NAFDAC is showing interest in this. The agency's Director General commends the approach to research adopted by the institution. She gives further assurance on the vaccines being administered in Nigeria.
What I've seen from these plants that they have now developed into what they are calling virucidin, the name and everything may be changed by NAFDAC just to make sure that we know exactly what stage it is. But I see it as potential. But once all the data are gathered and submitted to us, we test in the lab, then we list it. However, the approach that Abuad is taking, the scientific approach, is what should be taken for all herbal medicines.
Hopefully, the outcome of this visit by NAFDAC may reveal the readiness of the country's medical and academic research institutions, less dependent on foreign supplies in tackling medical emergencies such as the COVID-19 pandemic. Babajide Agbayo, Channels Television News.
So let's talk about non-pharmaceutical interventions. There's been so much controversy around the announcement of Phase 4 COVID-19 restrictions by the Presidential Steering Committee earlier in the week. Now, it raised questions really about just how involved the people are in this fight. Professor Titus Sibekwe is a public health professional and otorhinolaryngologist. Simply put, ear, nose and throat physician. He joins us live from Abuja this evening. Well, Prof, to be fair enough, there's not much difference between what we had in the third phase, Phase 3, and now what we have in Phase 4. On paper, that is. But in reality, a lot of people had forgotten that we were still in a phased restriction. So it begs the question, how often should this be repeated for it to stick? Or will it ever stick?
Thank you very much. Thank you very much, Kayode. The problem is still very much there with us. That COVID-19, even what is going on today in India, Turkey, and Russia, is something that should, make Nigerians to be on their guard. And that's why this whole process appear to be escalated again. The B1617 variant from India has been a thorn in the flesh. And very painfully, we realized that 3 cases have already been identified in Nigeria. And this is why the non-pharmaceutical preventive measures remain the key, which everybody must abide by. The use of face mask, physical distancing, and regular cleansing, which is washing of the hands, and respiratory hygiene. So these triads appear to be the panacea. However, we know that today even vaccination is ongoing, but it will be complementary because they must go together. So even after receiving your complete doses of the COVID-19 jab, it is very important to still keep on with these, non-pharmaceutical regulations by each and every one of us in the country. Even the management of the COVID waste is equally very key part of this hygiene, which unfortunately has not been all that emphasized. What do we do with this face mask? And the materials we use after walking around the whole day, how do we trash them? How are they managed? Are they just dumped in the open bin where scavengers and other people will go in there and get themselves contaminated? Are they well packaged in such a manner that they should be incinerated when we have a central collecting point? Beyond our homes, the environment, even the hospital premises, these are very important. Hygiene is the key in what we're talking of today. Even if we ensure, yes, that we have border restrictions and ensure that people are well screened before they come, surveillance is well carried out to reduce the possibility of importing more of this into the country. But we have to manage everybody, ourselves, the environment closely and guard it jealously to ensure that spread is very much, limited. So it is by doing this that we'll be sure that that preventative aspect of managing COVID-19 is adhered to, which is number one, even before vaccination and other measures that need to be applied. If, for instance, we look at what is happening in India today, it beats the imagination of so many, knowing full well that this is an heavily endowed country where the manufacturing of most of these drugs are going on. And their health system has gotten escalated and improved over the years, yet they are completely down and overwhelmed. We mustn't wait to get to this stage before we start applying measures. That's why what NCDC and indeed the PTF has come up with recently should be embraced by Nigerians. We know it's very difficult. It's not going to be full-blown, shutdown measures or lockdown measures as it has been before, but the key remains that the triad of these non-pharmaceutical, regulations among us remains the best panacea to, conquer this disease.
And hopefully, maybe if we get it right, there will not be any third wave whatsoever. But we'll keep our fingers crossed. Professor Titus Ibekwe, I would like to thank you so much for sharing your thoughts with us.
Thank you very much for having me.
Well, outside Nigeria, 1 in 4 of global vaccination population is in mainland China as the country makes great strides in its vaccination campaign. Well, data released by the National Health Commission today shows that more than 354.27 million doses have been administered across the mainland. The figure is up more than 11.59 million doses from the 342.69 million reported on Wednesday. Well, here's more on the global update.
China continues the campaign with the aim of building an immune barrier of 1 billion people against COVID-19 and has been accelerating inoculation paces across the country. East China's Shandong province has launched a new version of health code to encourage vaccination amongst the younger generation. Over in India, the COVID-19 tally rose to 23,703,665 today, with 362,727 new cases registered in the past 24 hours, while the death toll swelled to 258,317, with 4,120 deaths since Wednesday morning.
Well, don't forget to protect yourself. The virus is still out there, so continue to take responsibility and visit our website, channelstv.com, for all the updates that you need. And of course, a better understanding of the pandemic. We also have the big stories of the day for you, from politics to business, sports, and so much more. Well, that's the COVID-19 update for today. Thank you for watching. I'm Kayode Okikiolo. Once again, happy Eid al-Fitr.